From Jackson College, happy to welcome back the president and CEO, Dr. Dan Phelan, along with Dean of Health Sciences and interim co-chief academic officer, Heather Rutkowski. Welcome to the show.
Hello.
Thank you, Bart.
Nice to see you. Well, we're all out of time. Now, it's a long title. You got a lot going on.
I do,
Yeah.
yes.
So I think is it spring break this week?
Yes, it is. So for faculty and students, they're gone the entire week, and then administration and staff start tomorrow.
Nice. Well, thanks for coming in on spring break.
Pre-spring break.
Pre-spring break.
Yeah.
Well, a couple weeks ago, exciting event in the community at the American One Event Center. Alro Steel and the Glick Foundation gathered partners, including Jackson College and Spring Arbor University, to make a pretty significant gift announcement, which benefits the whole community, but you, along with your partners, SAU and Henry Ford.
Mm-hmm.
Very exciting.
Yeah, it's really transformational in so many ways when I think about the power of a gift, power of the vision. It is really significant not only for Henry Ford certainly and the endowment they're going to have of scholarships, but also to our colleagues at Spring Arbor University as well as Jackson College, and thinking about how we make that vision from Al Glick, how do we make that practical, and what does that look like? And I think that Heather and her team have done some amazing work in thinking about how we actually take that idea, that vision, and make it actual, make it practical, as something that is going to be used by students for a long time. So sustainability was a big part of our thinking about that. But we really wanted to have really state-of-the-art kind of an experience that students would have, and so Heather has come up with a really great idea about a medical simulation center, which we're excited about, and we'll be using this funding for that.
Yes, each partner has a specific plan for the money. And what is Jackson College's plan?
Well, working with Henry Ford, you identified that we all have a specific plan, but what was great about this is that our plans are so cohesive that it really guided the work that our whole team envisioned for our simulation center. It started out as a lab, just a traditional lab, but as we kind of come together and realized, to really make, the seamless transition and help students complete and identify competencies versus, completing a course and then moving on, we needed to really integrate what it was like to be in the healthcare setting. So simulation is really an opportunity to simulate what you might imagine could happen that may not have yet happened, but we needed it to not look so much like a classroom, not so much like a lab, and kind of break them walls down and create a true simulated healthcare ecosystem where the whole team comes together, and it's not a program at a time or nursing at a time, it's the entire healthcare team working in amongst each other to help the patient advance or from birth to death, including the end of care life. So
You really actually, I consider what you have at JC a health campus within Central Campus, because it does. I mean, it's pretty extensive, all of the health education facilities that you have at JC.
What I really like about Heather's design is how it really takes education in the round. In fact, on the graphic there is, Heather, why don't you go ahead and explain now? We've been blocking that already.
Yeah,
So this building, first of all, is?
This is the Justin Whiting, the first floor core. This is the Raoul Health Center. So what you're looking at is right now the entire first floor simulation lab. So this is quite a chunky block drawing. So you can see in the center in the green control room, that's a large observation space that gives us an opportunity to see all the way around all of the simulation bays. But it's creating a space that shows the flow of a patient moving through, perhaps coming through to the ER. So we have our ER simulation. And then we have a step-down unit. We have our operating surgical suite right now that's already there, so OR number 1. So this just gives us space where we're breaking down these walls and creating this an opportunity for somebody to walk through. We have an ambulance coordination center off in the far corner there. so we can simulate an ambulance coming in through that far end. We would be able to even use our driving simulator to truly bring in that whole feel. And then as you enter out into the hallways where you can see community service, this is another space where we want to implement the opportunity for a cooperative community service area to continue with the HealthWise. We've had that here a lot. So this block drawing just shows the expansions of some of those bays and inclusion of some of those, but often the hallway that you don't see in there is what we're bringing into our AR, our virtual reality and augmented reality. Another new out there is mixed reality. So this gives us an opportunity to bring in technologies such as a metaverse, where students here at Jackson College could be working with nursing students at Spring Arbor all in one space. So it's really just making an entire classroom look exactly like it would be if you were in a true hospital setting instead of a classroom.
Awesome. And really it has, you have had the simulation areas in the health campus already. You've got like an ambulance, and you've got patients or mannequin.
High fidelity
We have
mannequins.
high fidelity, low fidelity. We have, so, as we kind of spun around, I call it spinning around in the hallway and looking at the whole area and envisioning this, I thought, we have pockets of a healthcare ecosystem, including cybersecurity, IT, the whole system, but we've never brought it together. It's just always been in what I refer to as pocketed silos of healthcare. So this is going to create something much bigger than we've always had.
So having a long history of training healthcare workers, and I think nurses were among the very first students at Jackson College, right, Dan?
Exactly right. Exactly right. From the earliest of days, it has been a priority of our institution to be able to lean in and provide for the health care of our community. And the demand is huge. I think maybe I've shared with you in the past, but even today, tens of thousands of nurses are needed. We import over 2,000 nurses from Canada every day into this state. The demand is just absolutely palpable. And to the degree that we can make sure that our students come out with a fulsome education, with clinical experiences, with practicum experiences, and this kind of space that Heather's talking about is just going to be transformative, I really think. And incorporating AR and VR, I have difficulty with standard reality, let alone virtual and augmented reality. And then add on top of that, AI and generative AI, and how does that influence students? How does that influence healthcare? How does that influence pharmacy? I mean, how does it influence all these different areas, and how we move that forward? And it's going to be a standard fare, I think, increasingly with a hospital. And so we want to make sure that our students are prepared for this very dynamic, technical and virtual environment.
And the hospitals are looking for people who've been trained in this kind of a environment. So our students conceivably would have a leg up into the top jobs.
What I think is exciting about this is that the students can actually flow around the different cells, so to speak, kind of education in the round, so to speak. And I think about all the hands-on applicable spaces. I mean, it's just beautifully designed, and the fact that there's this control center in the middle allows faculty and students to be able to look at camera footage, film, to see how they're performing, how are they doing. And Heather and her faculty, the department in particular, you'll notice that ambulance coordination center on the top, they have actually completely simulated accidents on campus, and they film it from A to Z about the whole process, and then they'll break that down and have follow-up review of how that has gone and how students perform.
Yeah, the debriefing part of any simulation is one of the most important elements of it. So it was important to build the opportunity in simulation in space to have that moment, during and after each simulation.
We've come a long way since we were pushing ventilators around the parking lot.
That's right. That is absolutely true.
Old ventilators, used,
ventilator raised.
out of service ventilators.
That's right. Yeah.
All in good fun.
Yes. Yeah.
Now you've made some improvements in the programs in nursing to allow students to get actually a 4-year bachelor degree in nursing. How important was that, and the groundwork that's been made to expand nursing at JC into becoming a partner and ultimately a beneficiary of this type of a gift?
Well, we've been working on trying to offer a baccalaureate science degree in nursing we've been working on that for 16 years or better, and we weren't able to finally get to that space. But last year, legislatively, we had worked with leaders of the legislature to say, well, what can we do if there's just so much opposition to having community colleges having baccalaureate degrees in nursing, what can we do? And what came of that was an opportunity to partner with the university and then to be able to provide some seed support to be able to create the kind of space that we want for a baccalaureate science degree in nursing on campus. So that led to multiple conversations that Heather and I have had with a variety of university folks. We actually ended up with Grand Valley State University, one of the primary transfer institutions for our college. And they are on our campus now in the University Center. We just had an open house with them on campus here last week. And so we're excited to be able to have this 2+2 with Grand Valley State University. And with that comes an additional $2 million from the state of Michigan that we're actually going to append to the gift from the Glick family and the Glick Foundation to be able to create this very center that we were talking about that the graphic had showed.
Yeah, obviously that kind of development is going to take a lot of money, and you've already got the building blocks
Yes.
in place.
It's not just the building itself, but it's the setup of all the bays, how that works, and then you've got all of the technology on top of that. So high fidelity mannequins are incredibly expensive, but then you add in all the other elements that are necessary, the Hill-Rom beds, all the simulation systems. It's quite expensive, and so we are in debt to the Glick Foundation, Alro Steel, and Al Glick in particular, the Glick family, for this gift, because without their support, this kind of a project just wouldn't be possible. So we are deeply indebted and so grateful for the vision of Al Glick in making this reality possible for us, and combining that with state resources. This is going to be a spectacular center. We'll want to have JTV there for the grand unveiling when the time comes.
Yeah, we've seen some of the improvements of the health campus already. The dental lab, for example, state of the art. It looks like big city dental practice, and you're really trying to make it look like these students are working in a trauma center or a hospital or a dental clinic.
It's what they experience, and without that, when they first step out, then there's that additional learning curve. You know, now with the opportunity that we've been given and the vision that others see through their own experiences as a patient, which is so invaluable when somebody brings that in and says, this is what I experienced and I envision, you know, like, what if we helped you do this? That's an opportunity you cannot just walk away from, and then it just validates what you're thinking and seeing, and you can bring it all together.
And the students already are wondering, how soon can we start learning here? When can I apply? With the case of the scholarships, the programs, it's you've got a fast track schedule for all of this, don't you?
We do, but we've been thinking. That's the fun part of this, is that the teams have been together already thinking. I've been working with Henry Ford, and the meetings have been so energizing and inspirational, because we've been talking about this and saying, well, what if we did this, and you know, what if we started that, and to bring it together. We've been already moving faster than this has already been happening, so now we can catch up with our thoughts.
Dan, you're also on the board of Henry Ford Health. What does this mean from the health system standpoint to have a partner like JC training students in these health careers?
You know, we've had a long-standing relationship with the hospital over many, many years. We've had lots of conversations with Cindy Harrison, for example, the relationship we have, the meetings that Heather's had with her and her team. When you think about it, it is really a throughput experience. So they have the education at Jackson College. They might even be supported through the scholarships that the hospital now has as a part of the Glick Foundation. And to be able to have that experience here right in town, they're in our community. One of the most beautiful things about Jackson College, I think, is that we have well over 90% of our students who graduate stay in our community, which is really nice. And so that allows these individuals to go into the workplace. In fact, when you go into Henry Ford Health here in Jackson, chances are, I'm going to say at least 80% of the time, you're going to be connecting with someone who's been educated at Jackson College. What do you think about my percentage? Am I close?
Oh, I think you're very close. Absolutely. It would be hard to find someone that doesn't say, I came from Jackson College.
So that linkage between us is great, and I think Ellie Moorhead is the CEO there, and the team she's assembled, just great, wonderful people, great partners for us to work with, and it's a hand-in-glove operation.
Great evidence of how much Jackson's changed, how much JC has changed in the last 10, 15, 20 years.
Absolutely.
To have that kind of a statistic, 90% of the students educated at Jackson College in these health careers is staying right here. And it's 100% placement rate too.
Yeah, darn right.
Absolutely.
You know, it's also great too that our nurses pass when they sit for their state boards. When they sit the first time, whether they're an LPN or an RN, we beat state records and we beat national records for the pass rates of our nursing students the first time.
Yes.
That's incredible. They're right here in Jackson County.
Awesome, great points of pride. Something the whole community can be excited and proud about.
Yes.
Well, thanks for the good news and thanks for coming in today.
Thanks for having us
Thank
on, Bart.
you.
Heather Rutkowski is Dean of Health Sciences and Interim Co-Chief Academic Officer, and Dr. Dan Phelan, President and CEO at Jackson College. Lots